Leading medical groups right now are calling for mandatory vaccinations for healthcare workers because the reality is that there are a lot of healthcare workers who are still vaccine hesitant. If you're a cancer patient right now, what is the risk of going in for in-person care given some workers may not be vaccinated, and also because the coronavirus vaccines may not be as effective in immunocompromised patients? We talked earlier about how some patients are just unable to mount a full or very robust immune response in response to the vaccines.
Well, Yasmin, the people who are at most risk of having a bad outcome from coronavirus are the people who are immunosuppressed. Those are cancer patients, patients with certain rheumatologic illnesses, certain immunosuppressive illnesses as well. We need to protect those people at all costs. Uh, Quite honestly, the coronavirus vaccines have prevented 280,000 to 300,000 deaths in the United States since January 1. That means that they are the most effective drug ever developed. I don't use that phrase lightly. We do need to try to protect people who cannot respond to the coronavirus vaccine because of illness or problems in their immune system. And so I really do think that all of us in healthcare need to be vaccinated. We need to try to maintain hospitals and clinics such that people don't get the disease here. Now, going to things like telemedicine and other things and trying to keep patients who don't need to come into the clinic or to the doctor's office out of the doctor's office, that's another means of trying to protect them.
And just building on, you talking about how miraculous these vaccines have been in many ways, I want to ask you, especially with your past experience as president of a major medical group, the American Cancer Society, whether you agree or disagree that vaccinations should be mandatory for all healthcare workers.
Well, I was chief medical officer of the American Cancer Society. I actually do believe that vaccination should be mandatory, not just for all healthcare workers. I think it should be mandatory, just like measles, mumps, and rubella, diphtheria, pertussis, and other vaccines are in the United States. I think there's literally no one that I can think of who is over the age of 12 who does not qualify for this vaccine and should not be getting this vaccine.